Hello, everybody, and good morning. And our today's topic for the lecture is parturition and infertility. I will be sharing some of the video links so you could watch after the lecture class. Okay, so starting with parturition and infertility. First of all, in the last class, we have gone through the pregnancy and what is the end result of the pregnancy? It is parturition. What do you understand by parturition? Parturition is a process by which the fetus is expelled out of the womb, and the changes of pregnancy is again again is changes are again back to normal within few weeks to a month. Okay, so in this, there are uterine contractions that lead to expulsion of the fetus to extrauterine environment. This happens toward the end of pregnancy when the uterus becomes progressively more excitable and develops strong rhythmic contractions that lead to the expulsion of the fetus. What are the other words for parturition? These are the birth, delivery, childbirth, birthing, confinement, travel, accouchement, labor, giving birth, and childbearing. Okay. So you all know that uterus is an organ which have smooth muscles in it. Okay. And so uterus is spontaneously active. Spontaneous depolarization of the uterus takes place by the initiation of contraction from the pacemaker cells. There are gap junctions with the spread depolarization, but the exact trigger for the pacemaker cells are unknown. This can be the hormonal changes or the mechanical changes. Coming to the hormonal changes basically is because of the estrogen and progesterone. We all know that progesterone inhibit uterine contractility while the estrogen stimulate uterine contractility. So, uh, as the pregnancy advances, there is a shift in the balance of the estrogen and progesterone. From the seventh month till term, the progesterone secretion, both estrogen and progesterone secretion continuously increase, but the estrogen secretion is increased more, and thus there is increase in estrogen progesterone ratio. See, in this picture you can see that estrogen is this, the black line is that of the progesterone. Both progesterone and estrogen secretion is increased, but after the 24 or 26th week you can see that increase in estrogen is more as compared to that of the progesterone, the shifting the balance more toward the estrogen. Okay. So what does progesterone does? Progesterone decreases the gap junctions, it decreases the oxytocin receptors, it decreases prostaglandins, and it increases the resting membrane potential of the smooth muscle. While estrogen increases the gap junctions, furthermore with the increase of labor, it also increases oxytocin receptors and increases the prostaglandins. So if there is increase in estrogen from the 6th or 7th months of pregnancy, what will happen? There will be increase in gap junction, there will be increase in oxytocin receptors and prostaglandins. So the uterine muscles will increase their contractility, and as labor starts, these changes are accentuated. Okay. Now what does oxytocin does? Oxytocin there is a dramatic increase in oxytocin receptors toward the labor. In fact, there is 200-fold increase in the oxytocin receptors. So, there is a gradual transition from the passive relaxed state of the uterus to an active excited state. So, and thus there is increased responsiveness. Increase in oxytocin secretion occurs during labor. Oxytocin increases uterine contraction by directly acting on its receptor and indirectly by stimulating prostaglandin secretion. Now, prostaglandin, there is increase in oxytocin receptor and there is increase in prostaglandin. So, uterus will be more responsive to the oxytocin now, and since there is increase in prostaglandin secretion, prostaglandin also increase the contractility of the muscles. Prostaglandin, they have a central role in initiation and progression of human labor. They are produced locally or intrauterine. Oxytocin and cytokines stimulates its production further, and prostaglandin stimulate uterine contraction by two ways, both direct and indirect. Direct by acting through their own receptors and upregulating the gap junctions of the myometrium, and indirect effect is by upregulating the oxytocin receptors. Now there are some role of fetal hormones also on the uterus. Fetal pituitary secrete oxytocin, which might play a role in uterine excitation. Fetal adrenal gland, which secrete cortisol, can also stimulate the uterus, and fetal membranes can secrete the prostaglandin. So, both the fetal hormones and the maternal hormones are acting in hand to increase the contractility of the uterus. Okay. Now there is one more factor, that is the mechanical stretch. Along with the hormonal factors, this mechanical stretch is also acting uh, to increase the uterine contractility. What happens? There is the mechanical stretch can be due to the stretch of the uterine muscles or due to the stretch of the cervix. Stretch of the uterine muscles increases the contractility, and this stretch can occur because of the fetal movements or because of the multiple pregnancy. And this also, the stretch of the cervix also increases the contractility, but this contractility is by a reflex mechanism. So whenever you are doing a membrane sweeping or there is a rupture of membrane, this leads to stretching of the cervix. Also the fetal head, which pushing on the cervix and stretching the cervix, this provides the positive feedback mechanism, and both the stretch mechanisms and the hormones together work to increase the contractility of the uterine musculature. So you can see a positive feedback mechanism is present during the labor. You have studied in the homeostasis that there are two types of mechanism, the positive feedback mechanism and the negative feedback mechanism. Negative feedback mechanisms examples are replete. The whole body is replete with examples of negative feedback mechanism, but there are few instances also where there is, you can see positive feedback mechanism, and in that positive feedback mechanism, one is the stage of the labor, where the positive feedback theory suggests that stretching of the cervix by the fetal head finally becomes great enough to elicit a strong reflex increase in contractility of the uterine body. This pushes the body forward, which stretches the cervix more and initiates more positive feedback to the uterine body. Thus, the process repeats itself until the baby is expelled. Once the strength of the uterine contraction becomes greater than a critical value, each contraction leads to subsequent contraction that becomes stronger and stronger until maximum effect is achieved. Cervical stretching also causes the pituitary gland to secrete oxytocin. A second uterine contraction stronger than the first, a third is stronger than the second, and a fourth, a vicious circle is established. False labor in which the contraction becomes stronger and then fade away. See, the baby is pushing the cervix. Cervix is dilated and there is a stretch reflex initiated which excites the fundal contraction. Fundal contraction pushes the baby further and more dilatation of the cervix, and the cycle repeats over and over until the fetus is expelled. This you can relate yourself. There is increase in oxytocin receptors. Oxytocin receptors will increase the prostaglandin. These both will increase the uterine contraction, and uterine contraction will increase the dilatation of the cervix and distension of vagina. This will give a reflex or a stimuli from the vagina and the cervix, and there will be further increase in secretion of oxytocin, and thus increase in uterine contraction. Thus this cycle goes and goes on till the fetus is expelled. See what happens. First the baby moves deeper into the mother's birth canal, then pressure receptors in the cervix of the uterus is excited. These pressure receptors will provide afferent impulses to the hypothalamus. Hypothalamus will send impulses to the posterior pituitary, and this will release oxytocin. Posterior pituitary releases oxytocin to blood. Oxytocin, what will do? It will target the mother's uterine muscle, and uterus respond by contracting more vigorously, and again the baby moves deeper into the birth canal. Okay. Thus you can see a very beautiful example of the positive feedback mechanism. The parturition has three phases. Three phases, three, or in fact you can say four phases. First one is the phase 0 phase. Phase 0 is happens from the conception to the beginning of the labor, where the uterus is relaxed or quiescent. In the phase 1 there is activation or expression of contraction proteins. Phase 2 there is a stimulation, and this phase 2 comprises of stage 1 and stage 2 of labor. Here you can see cervical dilatation and the expulsion of the fetus. And in the phase 3 of the parturition, this is simultaneous with the stage 3 of the labor, where there is delivery of the placenta and uterine involution. You can see the uterine activity during pregnancy and in the post-pregnancy period. Here there is uterine activity is gradually increasing, and from the 7th month of pregnancy this activation is increased, and it is further increased at the time of the labor, and there is finally decrease in the activity, leading finally ending up to the last of the involution. So what are the inhibitors which are acting initially to decrease the uterine contractility? These are the progesterone, prostacyclin, relaxin, nitric oxide, parathyroid hormone related peptide, which are, and CRH and HPL. Now from the 6th or 7th month there is increase in estrogen, but simultaneously there are inhibitors also. These are the progesterone, prostaglandins, CRH. Prostaglandins, or in fact prostacyclins, not prostaglandins. and then finally there is increase in activation because of the increase in estrogen, oxytocin, and decrease in simultaneous means relative decrease in progesterone. Okay. Now coming to the phases of the parturition. Phase 0, where the uterus is quiescent associated with increased cyclic AMP. Okay. How the progesterone is acting? It is increasing the cyclic AMP level along with relaxin, prostacyclin, and PTH related peptide and nitric oxide. So increase in cyclic AMP will decrease the excitability of the smooth muscle and the uterus will become quiescent. In the phase 1, or which occurs in the third trimester, not exactly during labor. This occurs in the phase third of the pregnancy, in which this promotes a switch from quiescent to active labor, active uterus. There is increased excitability and responsiveness to stimulators because there is increase in expression of the gap junction. There is increased G protein coupled receptor. And what are the G protein coupled receptors? These are the oxytocin receptors, which are G protein coupled receptors, and this there is simultaneous decrease in cyclic AMP levels. So there is 50 times increase in myometrial oxytocin receptors. Uterus becomes responsive to uterotonics, and finally there is dilatation and effacement of the cervix, cervical softening due to rearrangement of the collagen fibers. Now the phase 2. Phase 2 of parturition occurs in last 2 to 3 gestational weeks. There is increase in synthesis of the cytokines, prostaglandins and oxytocin, and this include the stage 1 and stage 2 of the labor. So by phase 2 of the parturition means that labor has set in and the fetus has finally been expelled. Okay. In the phase 3, the stage of uterine involution. There is pulsatile release of oxytocin, and there is delivery of the placenta, and finally involution of the uterus that takes place in the 4 to 5 weeks post delivery period. Lactation helps in complete involution. What will happen? Lactation will be established. There will be further increase in oxytocin, and the oxytocin release is also pulsatile in manner. Pulsatile, what is the benefit of pulsatile release of the oxytocin? Pulsatile release of oxytocin will increase the milk production and will also increase the involution of the uterus. Now, what are Braxton Hicks contraction? These are the irritability of the uterine muscle, but the irritability is weak and slow. It begins about 1 month before labor. In contrast, stronger contraction, which initiate the stretch on the cervix and force the baby through the birth canal. These are the same as Braxton Hicks contraction, but of higher degree. True labor has circadian rhythm. It usually peaks between 12 midnight and 5 am, and so maximum babies are delivered in the night time. Labor pains due to ischemia of uterine muscle in early stage, then stretch of the cervix, perineum and vagina. Okay. Mechanics of parturition. What happens? There is increase in uterine contraction. Contraction starts at the fundus and spreads to the lower segment. Toward the end of the labor, the uterus is divided in two parts, the upper contracting part and the lower uh, flaccid part. Why this happens? Why there is a mechanism? Because As the uterus contracts from the upper portion, it pushes the baby in the lower flaccid part. So flaccid part stretches and this initiates further contraction. Okay. So contraction starts at the fundus and spreads to the lower segment. The intensity of contraction is strong at the fundus but weak at the lower segment. In early stages, there is usually one contraction per 30 minutes, but as the labor advances, the there will be one contraction per 1 to 3 minutes. Along with the contraction of the uterus, abdominal muscles also contract and it will help in the push down effect of the fetus. So this rhythmical contraction also allows blood flow because you must have studied that in the uh, uterine musculature the arrangement of the muscle and the spiral arteries, they are piercing the smooth muscles of the uterus. As the as the muscles contract, what they do, they produce a effect of living ligature on the blood vessels. So as they contract, they will completely shut off the blood supply to the uterus. So what will happen? What is the effect of the intermittent contraction or rhythmic contraction? When there is contraction, the blood supply is stopped. When it relaxes, again blood supply start. So this this feature this feature doesn't allow ischemia to occur. Along with this, since it prevents ischemia, it also helps in the uh, delivery of the fetus. Okay. Parturition and labor. These are two words are simultaneous, but there is a minor difference in which means parturition is, it denotes the whole process by which the baby is born. Whole process means, in fact, pregnancy is also included in the phase 0 of parturition, while labor is the process when the strong uterine contractions have set in, cervical dilatation is occurring, and the stage when the strong uterine contraction, cervical dilatation, which are forcing the fetus through the birth canal. When this stage is set in, then we say that labor has set in. Okay. Now the onset of labor. During pregnancy, what happens? There are periodic episodes of weak and slow rhythmical uterine contraction, and these are known as Braxton Hicks contraction, and Braxton Hicks contraction usually occur in the third trimester. Toward the end of the pregnancy, these uterine contractions become progressively stronger and regular, and when the labor has set in, then this contraction is associated with pain also. Pain along with cervical dilatation and effacement. What is the meaning of effacement? Effacement means gradually thinning of the cervical tissue. Okay. Now mechanism of labor. Labor, finally we have to, what is the aim of the labor? Aim of the labor is the delivery of the fetus. So there are three P's which denote the process of the labor. This is the power, passage and the passenger. Power is the uterine activity, passage is the birth canal, and the passenger is the fetus. So all three of these P must work in synchronicity to expel the passenger out of the womb. In the process of this passage, in the process of the movement of the passenger, there is gradual effacement and dilatation of the cervix. Okay, this you will see in the video which I will be sharing. Now, labor has three stages. Stage 1, which commences with the onset of the labor and terminates when the cervix has fully dilated and membrane has ruptured. This can take about 8 to 24 hours. Stage 2 is the stage of expulsion, which begins at full cervical dilatation and ends with the expulsion of the fetus, and this stage lasts from 1 to 30 minutes. And finally, stage 3, which begins with the delivery of the child and ends with the expulsion of the placenta, and this can take about 10 to 45 minutes after the birth of the baby. Okay? And finally, at the end of the labor, what you are getting? A healthy baby or any type of baby, but at the end of the labor you are getting a baby and the placenta and the membranes and the uterus is involuted. So now we have completed the parturition portion, and next we are studying about infertility. And the treatment options for infertility is, there are three treatment options. Okay, these things you will be learning, but just you have to learn about what are the um, basis of these treatment options. Okay, so what is infertility? This is the inability of a sexually active couple not using any contraception to conceive during 1 year, or when the age is less than 35, or 6 months when the age is more than 35, after marriage, or when the couple is sexually active for last 1 year without using contraception and the couple is unable to conceive. Now, one word is fecundability. What is fecundability? It is the chance of conception in one menstrual cycle. Even if everything is normal, then also the chance of getting uh, conception is only 15 to 25%. Means you can't say that if the couple is not have not conceived in one menstrual cycle, you can't say there is infertility, because the chance of getting conception is only 15 to 25%. Now this chance of conception decreases with age. As you grow, get aged, the chances of getting pregnancy gets smaller and smaller. Now we define infertility in two types: primary infertility and secondary infertility. What is primary infertility? In this, the couple has never conceived. And the secondary infertility, here there has been previous pregnancy regardless of the outcome. Means this doesn't mean that the couple has a child. That pregnancy can culminate in a healthy fetus baby, or it can be an abortion, but after that outcome, there is the couple is unable to conceive for the second time, third time. Okay, but the time duration is the same, as you have seen that 1 year and 6 months time is remains the same. Okay, now there are various causes of infertility. Causes can be sperm defect or dysfunction. These frequency is about 30%. There can be ovulation failure, tubal damage, and endometriosis, cervical mucus defect, uterine abnormalities, and there can be unexplained infertility also. Means that everything you are getting tested is normal, but still the couple is unable to conceive. and about 15% of couples have more than one factors for infertility. So, how to work up? You have to take the history. History is the key. Then focus on the physical examination and finally get the labs and specialized tests done to come to a conclusion. Okay. So, what are the basic evaluation we do? First thing, you evaluate the male factor by doing the semen analysis. Then you have to evaluate for the ovulation methods and uterine or tubal evaluation. So finally you have evaluated everything, the male factor and the female factor, both the factors you have evaluated. Now options available are ovulation induction, or you go for IUI or IVF or ICSI. Okay, you don't have to study everything in detail. Just know the names, what are the options available for the ART. What is ART? ART is the are assisted reproductive techniques. Okay. Now, what are the indications for ART? These are the tubal disease, male factor infertility, endometriosis, premature ovarian failure, polycystic ovarian syndrome, immunologic infertility, and unexplained infertility. These are the factors which form an indication for ART. ART at the birth by the birth of the Louis Brown in 1978, which changed the perspective for the field of reproductive medicine forever. She was the first child born out of IVF. Okay. And who was the father of the reproductive medicine? Patrick Steptoe and Robert Edwards of England are remembered for the revolutionary work. And he got the Nobel Prize in Physiology in the year. Robert Edwards got the Nobel Prize in Physiology in the year 2010. This is the way how the IVF process is done. First, the ovarian stimulation is done. Ovarian stimulation by various medications. You stimulate the ovaries to produce more and more eggs. Okay. Now the egg is formed in the ovaries and you pick it up. This is known as ovum pickup. You pick the ovum, then you fertilize in the ovum and the sperm in the lab. Okay. This fertilization takes place only when you have prepared the sperm. How the sperm is prepared? Sperm is prepared by diluting it in some medium and the healthy sperms are collected. Now these healthy eggs and the ovum which we have picked are allowed to fertilize in the dish. Then after fertilization, embryos or zygote is formed. This zygote then start dividing and at the blastocyst stage, that is 6 to 8 cell stage, what you will do? You will transfer the embryos in the uterus. Okay. This in this egg fertilization, there are two processes you have been shown. One is a dish where the sperm and the ovum are placed and they are allowed to fertilize by themselves. This is known as IVF. And this is the process. This is the egg, and the sperm is pushed in the ovum by this needle. This process is known as ICSI. ICSI means intracytoplasmic sperm insemination. Okay. Thank you for your kind hearing, and you must have studied or come to know about the process of parturition and IVF. Please go through this topic once, and nothing except few short notes can come in the exam, or two or three viva questions can be asked in the viva. Nothing more. Okay. Thank you.